Hello, my name is Abir, Khaled. I'm a senior scientist with Rapid Novor. I'm one of the scientists on the EasyM tests. At this IMS, we had two posters about exploring EasyM as an MRD test. It's a blood test, a non-invasive test. Our first poster is about an ongoing clinical trial with J&J and Princess Margaret Hospital here in Toronto. This one is an ongoing trial that is going to explore the use of EasyM as an MRD test. Speaking of MRD, MRD is a minimal residual disease, which refers to the small number of cancer cells that may remain in the body after treatment. MRD is considered as an adverse prognostic factor for multiple myeloma patients in comparison with MRD negative patients. Now to go to EasyM, EasyM is a mass spec based test. It's a blood test. And it's non-invasive. We monitor the M protein that it's the M protein that the patient produces. We identify and track the patient-specific M protein that are specific to each patient. Our second poster is also was based here in Canada. It followed 91 patients across Canada. This study mainly focused on comparing EasyM to two bone marrow-based tests. One of them is NGS 10 to the minus 5 to 10 to the minus 6. NGS is next generation sequencing. And another also bone marrow-based test, which is called multi-parameter flow cytometry, which is with sensitivity 10 to the minus 4 to 10 to the minus 6. It also included PET scan as another test to compare to. This study found that EasyM correlates very well with the current bone marrow-based MRD tests, and it especially correlates very well, or the best it correlates to NGS to the minus 6. But it found that the best approach is a hybrid approach, which uses EasyM and NGS 10 to the minus 6, which could enhance the predictive value of predicting relapse. And of a side note, 19% of the patients, which were followed for 3 to 5 years, they achieved MRD negativity by EasyM, and none of these patients relapsed so far. These are our conclusions from our posters. Let me know if you have any question.